Hi, I'm Sarah. I'm going to be your nurse today. What's your name?
Hi, my name's Melanie.
And what's your date of birth?
9901.
All right, so that would make you 19.
Yep.
Okay, she appears her stated age. She appears well nourished. How would you say your diet is?
Pretty good. I've been eating a lot of junk food lately, but I also get my vegetables in.
All right. I don't see any physical deformities at first glance. She appears alert and oriented times 3. Appears to have good hygiene, and just based on the little conversation we had, it appears she can clearly articulate her words. So today we're going to be doing a full head-to-toe assessment. Do you have any questions before we start?
No.
Okay, and if at any time you feel uncomfortable or have any questions, feel free to interrupt.
Okay.
All right, so before that, just on a scale of 0 to 10, 0 being the worst and 0 being no pain at all, and 10 being the worst pain you've ever felt, what is your pain rating today?
0.
So no pain at all?
No.
All right, great. So we're going to start. First, I'm just going to take a look at your skin. It's warm, dry, good pink color. I'm going to check your capillary refill, less than 3 seconds, so that's within normal. And we're just going to check your turgor. And both sides are good. So we're going to start right at your head now. And I'm just going to palpate your scalp and hair. Make sure there's no bumps or anything. Everything feels good. Your hair feels clean. It seems like you take really good care of your hygiene. So now we're going to start with your cranial nerves. So I'm going to have you pull your mask down. I'm going to have you close your eyes and obstruct one nostril. All right. And just let me know when you can smell.
Now I smell mint.
Yes. And on the other side.
Now I smell mint.
Okay, good. All right. Second cranial nerve. That was the first cranial nerve. So the second cranial nerve is her peripheral vision. So just let me know when you can see my finger looking straight ahead.
Now.
And the other side.
Now.
Good. Okay, checking the third cranial nerve is her pupillary response. I'm going to shine a light.
No. No.
Okay, so her pupils reacted as expected. They were equal. They accommodated for light. That was her third cranial nerve. Next, I'm going to check the fourth and sixth nerve. I'm just going to have you follow my fingers. Okay, so cranial nerves 4 and 6 are intact. Next, I'm going to touch this cotton ball to your face and close your eyes and let me know when you can feel it touch your face.
Now. 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 Now.
Good. And then I'm just going to have you clench and unclench your jaw. Good. So that shows me that both cranial nerve, or both of those show me cranial nerve 5 is in place, intact. Cranial nerve 7, I'm going to have you smile, frown, show me your teeth, and puff your cheeks. Okay, good. So that shows me cranial nerve 7 is intact. All right. Next is cranial nerve 8. So just let me know when you can hear me rub my gloves together.
Now. Now.
Good. So cranial nerve 8 is intact. Now we're going to look at your mouth. All right. So I'm going to have you open your mouth. The buccal mucosa looks good and pink. Tongue looks good. Teeth and gums look good. Can you stick out your tongue? So yeah. The uvula and palate both moved with that. And then her gag reflex is present, so that means cranial nerve 9 is in place. And then can I just have you stick out your tongue and back in? And then just repeat the words light, tight, dynamite.
Light, tight, dynamite.
That shows me cranial nerve 9 is still in place. And overall, her face contour looks good, even, and symmetrical. Lastly, you can pull your face mask back up. And I'm just going to have you turn against my hand. And the other way. And shrug your shoulders. Good, so that shows me cranial nerve 11 is intact. So I'm going to move down to your neck, and I'm just going to palpate, feeling for any lumps or bumps. Is there any tenderness?
No.
No? I'm going to check and make sure your trachea is midline, and it is. So now I'm going to palpate your carotid pulse. Strong 2+, and strong 2+. Alright, so now I'm going to listen to your carotid pulse with the bell. Good, so I was just listening for any turbulence, and I didn't hear any, which is good. That's normal to not hear any. So moving on, I'm going to inspect your anterior thoracic cage, and not feeling any lumps or bumps, anything unusual. It looks average. Your skin is warm, dry, and good color. So now I'm just going to listen to your lungs. Every time you feel my stethoscope touch your chest, can you just take a deep breath in and out? And if at any time you feel dizzy, just let me know and we'll take a break. Okay, so lung sounds were clear. I didn't hear any abnormal sounds, such as a wheeze or stridor, so that was good. So we're going to move to the back of the chest. I'm just going to inspect the back. It does appear that she has a little bit of scoliosis, so it is a little off-center, but overall the shape of the thoracic cage looks good. She's not completely round, which is good. I'm just going to feel any bumps, lumps, anything like that. Not seeing any. Skin feels warm, dry, and is a good color. So now every time you feel my hand on your back, can you just repeat the words 99?
99, 99, 99, 99, 99, 99, 99, 99, 99.
Good, and that was just checking for tactile fremitus, and that's vibrations. So I felt vibrations, and they were even and symmetric down the sides. Now I'm just going to percuss her lung borders. Good. So it was resonant where I expected it to be and dull where I expected the lung border to end. And now before I had done any of that, I would have gone to the 10th rib, squeeze, and take a deep breath. And out. And that just shows me that there's symmetric lung expansion because my thumbs move symmetrically when she took a deep breath. So now I'm going to listen for your lung sound. So once again, anytime you feel my stethoscope, take a deep breath. And if you feel dizzy, just let me know and we can stop. Good. So lung sounds, once again, were clear. No wheezes, stridors, anything like that, which is good. So now we're just going to do upper extremity range of motion. So we're going to start with your shoulder. First of all, can you put your arms to the side, above your head, behind your head, straight back, and behind your back. So that shows good shoulder range of motion. Next is your elbow. So flex. Yep. Good. And then rotate. So elbow range of motion looks good. And then just your wrist. So we're going to go up and down, side to side. And then lastly, your fingers. So spread them, point them down, flex them straight, make a fist, and then just touch your thumb to each palmar end of your finger. Good, so all upper extremity range of motion looks good. So I'm going to have you lay down. All right, so first I'm going to have you turn your head to the left. And I'm just checking for jugular distension. And I don't see any, which is good. I didn't want to see any. So next, I'm going to inspect your precordium. Just feeling for any abnormalities. Feeling for any thrills, and I don't feel any, and I didn't want to. So I'm going to palpate the apical pulse. Good, strong 2+. And now I'm going to listen to your heart, and I'm going to listen in a couple of places. Okay, so first place is second intercostal left sternal border, and that's the aortic area. Next place is second intercostal right sternal border, that is the pulmonary area. And then fifth intercostal right sternal border is the tricuspid area. And then fifth intercostal midclavicular line is the mitral area. And then I'm going to listen to the apical pulse for a full minute. Okay, so apical pulse was 60, and it was steady, even, and strong, which is what we expected. And then I'm just going to listen to the same places, but this time I'm going to use the bell. All right, good. And then I'm just going to have you roll onto your left side. And this is so I can listen for sounds S3 and S4. And I'm going to do that at the apical pulse. All right. And I was not able to hear S3 or S4, which is good. I didn't want to hear them because that's an abnormality. So moving down to your abdomen, I'm just looking quickly. Your umbilicus appears midline. You do have some scarring there. I'm guessing a belly button piercing.
Yeah.
But it looks healed now. I'm going to look for pulsations. I don't see any, which is good. I don't want to see any pulsations. So I'm going to go straight to bowel sounds. Starting in the right lower quadrant. Vowel sounds were active and present in all 4 quadrants, and now I'm going to listen for vascular sounds. Okay, and I didn't hear any vascular sounds, which is good. I did not want to hear any vascular sounds. So now I'm going to palpate the abdomen. I'm going to start with a light palpation, just feeling for any tenderness. Let me know if there's any pain. Once again, in all 4 quadrants. Now I'm going to do a deep palpation, checking for any organ swelling. And everything feels normal. Now we're going to move down to and the skin on the abdomen felt warm, dry, good color. So now we're going to move down to the lower extremities. So just palpating. Don't feel anything unusual, no lumps, bumps, or anything. No lower extremity edema, which is good. Skin is warm, dry, good color. Checking the feet for turgor. Looks good. So we're going to do some range of motion. First, we're going to start with your hips. I'm just going to have you lift your legs straight up.
Sorry.
That's okay. And the other leg. And then move your leg to the side. Good. And the other one. I'm going to have you bend one knee and lift the other leg up. And switch. Good. And then keeping that knee bent, I'm just going to have you rotate in and out. Good. And then you can straighten both legs. So we're going to do ankle range of motion. I'm just going to have you pull against my hands and push against. Good. Can you rotate out? Good. And in. And just in a circle. Good. And can you just move your toes? Good. Your toes look good, well kept, nails trimmed. Capillary refill is less than 3 seconds, which is good. So now I'm just going to check for some pulses. First, your posterior tibial, 2+ on both sides, and dorsalis pedis, 2+ on both. All right, so I'm just going to have you sit back up. All right, we're just going to finish up with some neurological checks. First, I'm going to hold my finger here, and I'm going to have you touch your nose, and then touch my finger. Good, and that's just checking your coordination and cerebellar function. So next, I'm going to have you touch your thumb to each one of your fingers. Good, and that's just checking the same thing, coordination, cerebellar function. I'm going to have you run your heel down your shin. Good. All right, now I'm going to have you stand up and walk towards me and back. Gait is normal, even, and what we expect. And now I'm going to have you walk heel to toe. Good. This is just checking for balance. She seems to be well balanced. So now I'm going to have you, turn with your back. I'm just going to have you close your eyes and have you balance. All right, and normally I would check for about 20 minutes, but she clearly is very balanced, so you can go ahead and take a seat. So yeah, I would have checked that for 20 seconds, but she was all set. So that finishes up our exam. Do you have any questions?
No.
No? Okay, well, you looked good. Everything looked good. So thank you for your time, and I hope you have a good day.
Thank you, you too.